According to the CDC, at least 1 in 25 patients have one hospital-acquired infection at any given time.
Wow, that's a lot.
That is a lot, Sarah. But as nurses, what can we do to decrease the incidences of hospital-acquired infections?
Well, that's a good question, Brooke. Most facilities implement protocols for hand hygiene to reduce hospital-acquired infections.
After hours of exhaustive research in UC Library's online database, using specific search criteria and limitations such as peer-reviewed articles, written after 2007, written in English, and full text available online, and using keywords such as hospital-acquired infections, hand hygiene, infection control, infection prevention, and personal protective equipment, we found 3 compelling articles on the subject. The first article, published in the American Association of Critical Care Nurses, entitled Use of a Patient Hand Hygiene Protocol to Reduce Hospital-Acquired Infections and Improve Nurses' Hand Washing, was rated a 2A. Our second article, published in the Journal of Clinical Nursing, entitled Impact of a Multifaceted Training Intervention on Improvement of Hand Hygiene and Gloving Practices in 4 healthcare settings, including nursing homes, acute care geriatric wards, and physical rehabilitation units, was rated a 2B. The final article we found pertaining to our PICO question was published in the British Medical Journal and entitled Physical Interventions to Interrupt or Reduce the Spread of Respiratory Viruses, was rated a 2B. All evidence found within these studies consistently demonstrated the importance of proper hand hygiene in preventing infection.
As demonstrated here, using GermGlow, a product which imitates the behavior of germs, you can see that even with proper hand washing technique, hand washing alone may not be completely effective in preventing the spread of bacteria. Even using proper technique, there is still residual residue along her nail beds and her wrists. For this reason, the addition of anti-infective agents such as alcohol-based hand sanitizer and chlorhexidine wipes, and the proper use and donning of personal protective equipment are so crucial in preventing infection in any hospitalized patient. In the clinical setting, it was observed that due to time constraints or just lack of awareness, hand hygiene and PPE protocols were not consistently followed.
So as nurses, how can we help fix this?
Well, I think the introduction of education programs into the hospital to staff and patients could improve patient outcomes, including everybody in that care, like us nurses, PCAs, specialty technicians, the patients, and also a big important one, their families, and making sure they understand the importance of these protocols to reduce hospital-acquired infections.